is a review on the pharmacologic evidence of green tea in targeting tyrosine kinase. I'm Joyce Lee, one of the authors of this paper. Tea is a widely consumed beverage worldwide. Among the three types of tea, green tea has been most widely studied for its potential health benefits. Green tea contains several polyphenols, including catechins and flavonoids. The major catechins found in green teas are listed here. Among them, EGCG contributes to the greatest proportions. Tyrosine kinase can be divided into receptor tyrosine kinase and non-receptor tyrosine kinase. Abnormal activations of specific tyrosine kinase is observed in various diseases. It is suggested that EGCG can inhibit tyrosine kinase activations or interfere with the downstream signaling pathway, thereby improving the disease outcome in relevant patients. In this article, we review the evidence of green tea on multiple targets, including epidermal growth factors, insulin-like growth factors, vascular endothelial growth factors, the downstream signaling pathway, lipid graph, the synergistic effect of green tea with other agents, as well as non-receptor tyrosine kinase and protein kinase with dual specificity. EGFR is a receptor tyrosine kinase which moderates cell growth, differentiation, and survival. The proposed mechanism of EGCG on EGFR include inhibiting ligand bindings and reducing phosphorylations of EGFR on HER3. Studies have been conducted on numerous cancer cells, such as head and neck squamous carcinoma, colorectal cancer, breast cancer, and human oral malignant keratinocyte cell lines. Reduced cancer cells proliferations and migration are observed in some studies. Activations of IGF-1 receptor stimulates proliferations, reduces apoptosis, and alters metabolism in tumor cells. Increased serum IGF-1 levels or increased expressions of IGF-1 receptor provokes higher risk of various cancers. Proposed mechanism of EGCG on IGF-1 include reducing receptor phosphorylations, increasing the level of IGF binding protein 3, which could contain IGF in the inactivated form and inhibit its functions, and down-regulating the signaling of IGF-IGFR axis. Reduced angiogenesis and reduced formations of capillary tube-like structures are observed in certain cancer cells. EGCG can inhibit VEGF-VEGFR signaling through suppressing VEGF productions and inhibiting VEGFR phosphorylations. Studies have been conducted on gastric cancer cells, head and neck squamous cell carcinoma cells, breast cancer cells, lymphocytic leukemia cells, colon cancer cells, and hepatoma cells. Besides, concurrent use of EGCG with EGFR inhibitor may provide synergistic effects in targeted therapy. Non-small cell lung cancer cells that respond well to EGFR inhibition are generally mutated, which make the EGFR more responsive to the ligand. Nevertheless, the tumor cells can undergo a second site mutations, which make the cells resistant to reversible EGFR inhibitions. EGCG can block ligand-induced Cmax phosphorylations in non-small cell lung cancer cell lines and provide additive inhibitory effects in both alternative sensitive and alternative resistant cells. EGCGs can also overcome germplasm resistance by inhibiting germplasm-induced autophagy and earth phosphorylations in WAF-MEK-ERT pathway. Other therapeutic evidence of EGCG on tyrosine kinase have been discussed in this article. You may refer to the paper for more information. To sum up, green tea extracts has shown efficacy in reducing tumor proliferations, angiogenesis, metastasis, and promoting apoptosis in vitro and in vitro studies. Green tea extracts properly acts on multiple receptor targets, and combination of green tea extracts with tyrosine kinase inhibitors may provide synergistic effects in improving the treatment outcomes. However, it remains unclear whether green tea extracts drinking green tea can bring similar benefits as that observed in green tea extracts. It is essential to select suitable recipients before treatment with green tea or green tea extracts. Thank you for listening to this podcast.